Hi, I'm Dr. Kate Kresge, a naturopathic doctor and a huge fan of the Redefining Medicine podcast. Like you, I tune in to get inspired by the visionaries who are moving whole person care forward. Whole person care takes a whole lot of work, and staying inspired is half the battle. The other half? Finding the right partners to support your practice. That's where FullScript comes in. FullScript helps you capture patient data, dispense supplements, order lab testing, and keep your patients on track, all in a single platform that's completely free. FullScript helps you streamline your workflow, grow your practice, and deliver whole person care at scale. And with FullScript's acquisition of Rupa Health, you'll have access to even more lab tests on top of the 1,000 already on the platform. I can think of 100 reasons to join FullScript, and you can read more about them at fullscript.com/A4M. Now, back to the podcast.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erika Schwartz. For more than 20 years, Dr. Erika has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erika is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, we're in Boston, A4M's BHRT Symposium, Peptides, Module 3 for certification. We have 600 people. Many of them are new. It's amazing. And today I have Amy Paoletti, who is the Director of Medical Education for A4M. Without her, none of this would happen. And the interesting thing is, we're going to be a switcheroo today because she's going to be doing the interviewing. I'll be doing the interviewee.
All right, Dr. Schwartz, you're in the hot seat today.
Woo! Very exciting.
So, super excited for the re-release of Don't Let Your Doctor Kill You. So tell me, what motivated you to re-release this book?
A lot of things. The motivation really came from the fact the healthcare system has not improved. It's actually gotten worse. I feel like COVID had a chance to improve it and then actually didn't improve it and made it even worse. It created problems with treating COVID per se, with the division over the mRNA vaccine. There's so much going on that it's really gone in the wrong direction. And then the other thing is AI came. I'm very pro AI, and I think AI can help improve the doctor-patient relationship by removing a lot of the stuff that is protocols, algorithms, and so I'm talking a lot about AI, and I'm also talking about patients and about stories and about how horrible healthcare is and how staying away from the hospital, you need a lot of tools to have the strength to take control of your health and not be afraid. And it's pharma's hold is getting tighter and special interest is getting tighter. And I think that we have to change it. We have to. And the answer is with each one of us. Each one of us has the ability to change it. And I'm not against doctors. It may sound like I am against doctors with that title, but the truth is doctors don't know better because medical school is a cult. And we have to stop because it's the same education they're getting now as they got 50 years ago. It may be different people, but the truth is, if it's the same type of education, and we need to change the education in order to really change healthcare, and we desperately need it.
So a couple times you've mentioned patient stories. Is there any particular patient story that exemplifies this book's message? Why this book's message is so important?
Yes. There are a lot of them, but I'll give you one.
Is there any one that just...
I'll give you one. The story of a patient who actually wound up having a hysterectomy because she couldn't say no, because she got scared, because she was told that she needed the hysterectomy, even though she didn't know how to ask why. Why? Ask why. And people are afraid because they think doctor knows best. Doctors don't know best. The doctor doesn't live in your body. You live in your body. So take the information that the doctor's giving you and then step back. Don't react. Don't react. Slow down. Do your research. There's a lot of research out there you can do. And then think about it. I have a patient today who has bladder cancer. He's an 80-year-old man. He's a healthy 80-year-old man. To do the biopsy, they punctured through his bladder. So he almost died from an infection caused by the biopsy. The biopsy wasn't thick enough to show how deep the cancer was. People don't die of bladder cancer. And now, in 6 weeks, he has to have it done again, the biopsy, and then probably, if they don't perforate, installation. This is a man who 3 weeks ago was playing pickleball. So it's the healthcare system and the fear that we're missing something that's really killing us. So that's why I'm saying don't let your doctor kill you, because you have the power. And I want to empower people and I want to give them the tools. And they call it a playbook, which I think it's funny, but it is a playbook, but it's a playbook with your health. It's not a joke.
So what feedback have you received from the medical community about the advocacy for patient empowerment that you're so passionate about? And let me just say, I know in our community, our A4M community, it's very much appreciated, but do you ever feel like you are scrutinized or get pushback from the other community? Because you practice in New York City, big community of doctors.
And the first book, the first time it was released, I was invited to talk about it at Downstate, which is my alma mater, but it's a conventional medical school. So I'm not getting pushback the way you would expect it. But they're avoiding it. Having said that, a lot of them are coming to me and asking more information. And I'm sending them to A4M. And I'm saying there is a place where you can actually get the information.
Do you think the reception of this version then is more positive, it sounds like, than maybe the original version that was released?
I think so. And I think, we didn't even expect it to be released so early, right? It was supposed to be released in October. But I think that it should be positive because the timing is different, because the world has changed. The American public is asking. You have the social media that's doing an enormous amount of information sharing, that some of it may work, some may not work. People are starting to question the validity of a lot of stuff. And I think by giving the information that you need to make the proper decisions for yourself and taking away the power from the medical profession and giving it to the patient, I think will change and should get, and then I have the endorsements from Kelly Ripa and people who are really well respected that should help people at least read it and use it, because they have a step-by-step manual of how to do it. And everybody should go to A4M, obviously, but that's a different story.
So, and I think you practice this, but what is your ultimate vision of how the doctor-patient relationship should function? And I think you do a good job of this in your practice, but overall, if you were giving advice to clinicians.
Take your ego out. Admit when you don't know. Tell the truth. And the truth is, you don't live in the patient's body. You have no idea how the patient's going to react, even if you've been doing it for 40 years. And if you tell the patient you don't know and say you're sorry if it doesn't work out, and create a good relationship that's based on truth, and teach the patient to ask why, and take away fear. I think it works. I know I have patients who've been with me for more than 30 years, and I love it. It's only one of me, and I want to leave as a legacy the importance of how the doctor-patient relationship will determine the outcome. Yeah, lifestyles, hormones, peptides, supplements, diet, exercise, stress management, sleep, everything affects the outcome. But the doctor-patient relationship has to be really important. You can't minimize it. You can't say, oh, he's a good surgeon, but he's not a great person. Then you don't want them. You want the doctor to really represent your best interests. They have to work for you. And I think that that's really the most important part of it. And I think you're better off with no doctor than a doctor who doesn't care.
Right now, is there anything that's giving you hope for healthcare, the future of healthcare?
Yes. Well, I'm an optimist.
I know.
I'm an eternal optimist. And I'm an eternally passionate about what I do. And I hope that healthcare improves. And that's why I'm at A4M, because I think that's the beacon of light for the future of medicine. And I see every day, and I was saying about the new people who are interested, and the fact that we have so many new people every time, it tells me that they're seeing that the way it's being taught in the conventional system doesn't work. And this is part of the way it works. And what you do is really promoting education, because it's all through education. So it's the patient who can demand the change, and it's A4M who will provide the education necessary so the patient gets that change.
We are so excited to have you speak at our upcoming Women's Health Summit that's focusing on menopause. You'll do a talk on somewhat the disparity in women's health. You've seen a lot of it through your career. And there's hope, I think, on that front as well. I think
Everywhere.
A lot of research going on women's health. So we'll see you in October in Scottsdale, Arizona. And then we'll see you at the big show, the big A4M conference, Longevity Fest, December 12th, 13th, and 14th. Catch her on main stage a couple times. She'll be lecturing, she'll be doing some interviews, and lots of book signing for this great book right here.
I love it. And I can't thank you enough.
Thank you.
Thank you.